Hello and welcome back to OET Prep Talks. Today I'm going to address a question which all of you might have had at some time of OET preparation. When it comes to OET writing, there's a lot of confusion about the usage of I in a sentence in OET's letter. So often I am asked, can I use I in a sentence or the active form? And what is the importance of passive form in OET's writing? So that's what we'll be looking at today. And this is very important for you to get ready and get going with OET's letter writing and get a great score for OET's writing task. Now, before we go into those concerns and areas, let's look at how a simple sentence looks like in English. In English, we have what's called the SVO pattern, where you have a subject, verb, and an object. So on the screen, you have a sentence now. The nurse administered an injection to the child. Now, the nurse is the subject or in the position of the subject. The verb is administered or administered the injection, and the object is the child or the receiver. So the nurse, being the subject, is the doer of the action. And remember, subject would typically be a noun. So it could be a person, a place, or a thing. And the object also would usually be a noun. So the object in this case is the receiver of the action. Now that's a sentence in its active form. Now when we convert that sentence, change that sentence into passive form, what happens is that the object in the initial sentence now takes the position of the subject. So the child, who was the object, now becomes the subject. So the sentence becomes: the child was administered an injection by the nurse. Now, by the nurse can be mentioned or can be omitted. So in that context, the nurse, who was the subject in the active sentence, now is referred to as the agent. The doer is the agent, but no longer the subject of the sentence. All right, so that's how we transform from active to passive and vice versa. Right, so in OET's context, there is absolutely no problem with you using I in a sentence, in using active sentences in the letter. That's all accepted. But there are certain norms and conditions where the passive form is better. So we're going to look at 4 instances when it is better to use the passive form in writing. All right, so let's look at those 4. Now, the first instance is when you want to focus on the object of the sentence. So sometimes the object is important, or you want to highlight the object, and in such instances we use the passive form. For example, now look at the sentence: a psychiatrist will review Tom's depression tomorrow. Tom's depression is the object. When you want to highlight the condition, which is Tom's depression, it's better to switch to passive form. So Tom's depression will be reviewed tomorrow. So the importance is for Tom's depression, and it's going to be reviewed tomorrow. Now the agent can be mentioned, but it's not really necessary. You are not focusing on the psychiatrist. So the sentence would usually in passive form be: Tom's depression will be reviewed tomorrow. Or you can also include the agent. There's nothing wrong with that. Tom's depression will be reviewed tomorrow by a psychiatrist. That's all right. So it's optional. By the psychiatrist or by a psychiatrist is optional. You can include the agent or you can omit the agent. So that's the first instance. But if you want to focus on the subject instead, then go for the active form. So a psychiatrist will review Tom's depression tomorrow. So you're highlighting that the review is going to be done by a psychiatrist and not a GP. All right, so in such instances, definitely there is no harm in using the active form. The second instance is when the agent is clear. We have seen who the agent is. In the active form, the agent is the subject or takes the position of the subject. So the agent is the doer. In a lot of clinical settings, it's very clear who the agent is. It's so clear, it's crystal clear that you don't have to mention. An example would be paramedics transferred the patient to the hospital in active form. Paramedics transferred the patient to the hospital. Now, if the patient is being transferred to the hospital, let's say an ambulance transfer, typically it would be by paramedics. So it's clear that it's the paramedics who have brought the patient to the hospital. So in such instances, we can move to the passive form. The patient was transferred to the hospital. It's clear that it would have been the paramedics who transferred the patient, and you don't have to mention that. So that is the second instance when it's appropriate to use the passive form in OET's writing. Now, the third instance is when the agent is unclear. Quite often in the process of treatment or the clinical journey of a patient, a lot of agents might not be known. For instance, somebody was brought in from another hospital. You have no idea who the treating doctor was, or all those people might not be clear. And in such instances, the passive form is more appropriate. So I've got a few examples. All right, somebody should show Amanda how to change the wound dressings at home. So we don't know who is going to show Amanda at the time of discharge. Somebody is going to show Amanda how to change the dressings, and we have no clue who that person is going to be. So the agent is unknown. So let's switch to passive form. Amanda should be shown how to change the wound dressings at home. I've got another example, and this is from the OET's official samples available on OET's website. He was prescribed steroid cream, but after experiencing personality changes, aggression, and sleep loss. All right, so he was prescribed steroid cream, but after experiencing personality changes, aggression, and sleep loss. That could have been done some time ago. So that's part of a patient's past medical history, and we have no idea who would have done the treatment or the prescriptions at that time. So the agent is unclear, and the passive form is ideal in this context. But if the agent is known and you want to mention that, you can use the active form. The district nurse should show Amanda how to change the wound dressings at home. So the agent is known, it's going to be a district nurse, and you're writing, let's say, to a district nurse to show Amanda how to change the wound dressings at home, and that's perfectly all right to use the active form when the agent is known and you want to highlight that. And the final instance where it is appropriate to use the passive form is when the agent is unimportant. For example, emergency physicians admitted Leroy to the burns unit this morning with smoke inhalation injuries. Now, it's not important who admitted Leroy to the burns unit. What is important is that Leroy was admitted to the burns unit with smoke inhalation injuries. So we would use the passive form, which is Leroy was admitted to the burns unit this morning with smoke inhalation injuries. Who admitted is not important at all. So that's again the final instance for using passive form. I've got another example again from OET's official sample. She was admitted to Green Valley Hospital with fever, pleuritic chest pain, tachycardia, and general malaise. So who admitted her is not important. We're not bothered about who admitted her. What is important is that she was admitted with these signs and symptoms. Again, when the agent is important, you can switch to active form. I suspect a relapse of pericarditis, perhaps with complications. Yet another sentence from OET's official sample. Now here, you as the treating nurse or doctor or whoever, you are suspecting this condition. So it's important that it is your diagnosis or your provisional diagnosis which you are writing about. So in that case, it's perfectly okay to use I in that context and use active form as well. I repeat, I suspect a relapse of pericarditis, perhaps with complications. All right, so to recap, we were looking at the 4 major instances when it is better to use the passive form in OET's writing task. I hope this knowledge and these tips will help you to write better letters, excellent OET letters, and get great scores like A and B for your test. Best wishes for your OET preparation. Do not forget to subscribe to our channel and click on the notifications icon to be updated of new lessons. Thank you very much.